Welcome to PO Medication Return. Hello students, good morning. I'm glad you could join me. We're going to be giving medications to Mrs. Cortez this morning. I've talked to her about the fact that you're going to come in with me, so let's get started. The first thing we're going to do is we're going to grab Mrs. Cortez's chart. We want to look through the chart, make sure we have Mrs. Cortez's chart, Mrs. Maritza Cortez. We're going to turn to the doctor order section. Okay, we've gotten to the physician order section. While we're looking and opening her chart, we want to check the chart for several things. We're giving her medications. We want to make sure she doesn't have any allergies. We want to make sure that she has no swallowing difficulties. We want to make sure she's not on any fluid restrictions. And we're going to flip to the medication section and read her order. We want to check for the rights of the medication. So we want to make sure the medication has a route. We want to make sure the medication has a dose. The medication has a time. We want to make sure we have the right individual. And we want to make sure that the medication order itself is done, date and timed and written timely for this patient. This patient is on Lasix, 20 milligrams, PO BID, potassium chloride, 20 milliequivalents, PO daily, digoxin, 0.25 PO daily. We want to hold her digoxin if her heart rate is less than 60. Augmentin suspension, 400 milligrams PO, Q12 hours. And that is our order. We're going to take the chart, set it down, and gather our supplies. What we're going to need for her medication administration is a medication tray. We're going to need some medication cups. And we're going to need the patient's MAR record. So prior to getting started here, we want to wash our hands. Hand hygiene is very important throughout all nursing actions that we take. The other important thing with washing hands is letting our hand sanitizer dry prior to taking any action. So just rub your hands. You need the friction when you're using a no-rinse sanitizer. Okay, so we're going to open the medication record and we're going to find Mrs. Cortez. And this is what our medication record looks like. We're going to compare just for accuracy to make sure our medication order was transcribed correctly to her MAR. We see her Lasix 20 PO BID, her Lasix 20 PO BID, her potassium chloride 20 milliequivalents PO daily, her digoxin 0.25 PO 1 tablet daily, and her Augmentin suspension 400 milligrams PO Q12 hours. So at this point we are done with her chart. Since we've identified everything is accurate and correct, we're going to put it aside. Also at this time take her MAR out of the medication record here individually so that we can put this aside and have more room on our medication cart. At this point we're going to do our first medication check. So we're going to set up our medication cups and we're going to get out her medication drawer. Maritza Cortez, Maritza Cortez. We want to perform our first check by identifying our medications, first being Lasix. So we're going to look for the Lasix tablet. We have Lasix, 20 milliequivalent tablet, 1 tablet. And we look at the expiration date. This expiration is 5/2011, so that is good. The next is her potassium. Here's her potassium. It's 20 milliequivalents, 1 capsule. Expiration date 5/2011. So that is good. And the medication is all intact. The packaging is intact. Next one is her digoxin. Digoxin, 0.25 milligrams, 1 tablet daily. So we have 1 tablet, intact. Expiration date 9/2012. So that's good. And then Augmentin. It's 400 milligrams, and this is a liquid medication, so we need to look on the bottle and see the equivalent for the concentration. This Augmentin is 400 milligrams per 5 mLs. So we know, being the dose is 400 milligrams, the patient needs to take 5 mLs, and that is our first check. Okay, our second check, we're going to put our drawer to the side. We will perform, and then we will place it in the cup. First being is our Lasix 20 and 1 tablet. We're going to put that in the cup. potassium chloride, 20 milliequivalents, potassium chloride, 20 milliequivalents. And put that in the cup. Then we have digoxin, 0.25 milligrams, 1. And we're going to put this in a separate cup in case the patient's heart rate is lower than 60 and we can't give the medication. And then last being our augmentin. Again, 400 milligrams per 5 mLs, 400 milligrams we need to get poured out. When handling a liquid medication, you want to put your cup on a flat surface. You want to pour and bend, open your cup. You want to cover your label so that you don't drip on your label when you're pouring. We're going to shake our medication bottle up well to make sure it's all mixed, and then remove the lid. Making sure that we put the lid upright to not contaminate. We want to bend down when we're pouring our liquid medication so we make sure that we can see the correct amount. And at this point, we could wipe off the top of the bottle so that we don't trip down and get onto the label. So this is our second, that was our second, and now we're going to do a third check because we're going to put this away and not bring the bottle with us into the room. So we want to make sure we have 400 milligrams of augmentin in 5 mLs, augmentin 5 mLs. We've checked the expiration date. It expires 5 of 2011. And here's our 5 mLs. Okay, we're going to put the augmentin away. At this point, students, we're ready to go meet Mrs. Cortez and bring her medications. We're going to get to the room.